Hey, good morning, guys. My name is Christopher South, and I am the ambulance director at Cavalier County Memorial Hospital here in Langdon, North Dakota. And that's kind of a Valentine's Day special about cardiology. A lot of folks don't believe it, but there is such thing as dying from a broken heart. And so what I want to do is just do this little quick presentation for you guys about, you're going to really enjoy this. So I hope you like it. Just give me just a second to pull up here. All right, guys, so this is a Sick Sad Heart. It's a Valentine's tribute to an unusual cardiovascular illness. So everybody, I think, has at one time or another in their lifetime has definitely experienced a sad heart. I know I have after my divorce. I still kind of deal with it, as a matter of fact. But that's for another presentation. So let's kind of take a look at a little case study. So he is gone. What will I do? A 71-year-old female is on the scene of a cardiac arrest where he had just had an unsuccessful attempt and broke the news that her husband has passed away. Understandably, she is quite upset at the sudden loss of her husband and is crying and begins to tell you that he was the only man that she ever dated and got married to right out of high school. And she tells you that 3 weeks ago was their 53rd wedding anniversary. As she sobs, you try to comfort her, and she tells you, he is gone. What will I do now? You try to develop an answer, and suddenly she clutches her chest and begins to have trouble breathing. She appears like she's in distress. She's holding her chest very tight. You start to wonder, is this real or is it something triggered from grief? So what should we do? Well, obviously, if anybody's having chest pain, we should perform our chest pain protocol. So we decided to do an assessment. The patient describes their pain as substernal chest pain that is an 8 on the pain scale, and her vitals are the following. Her blood pressure is 88/56, pulse is 120. She's showing sinus tachycardia on the monitor when you first put it on. Before you do a 12 lead, and can really pull it out and see what's going on. Respirations are 24 and labored. Our SAT is 93% on room air. So you do a strip and you see the following. Looks like she's got new onset of a left bundle branch block. And you're thinking, wow, left bundle branch block could be an MI. So we go ahead and prepare the patient and begin treating as if she's having an MI. This patient is a picture of health. So when we do our history, you discover the patient has no cardiac history, no significant risk factors for cardiovascular disease. Very healthy lady. She only has a history of osteoarthritis and an allergy to penicillin and takes Cymbalta daily for osteoarthritis. So we have a new onset of left bundle branch block with chest pain. Is it an MI? So we assumed that this could potentially be an MI and begin transport. We floated up in the ambulance, transmitter EKG. We started out on oxygen at 2 liters per minute via nasal cannula. We administered 324 milligrams of PO. We don't give her any nitroglycerin and no morphine because of her blood pressure's kind of low there. We start an IV and begin a fluid bolus. You transport her to the emergency room. So at the emergency department, we pull our labs. We do our routine laboratory tests, including a CBC, lipid profile, electrolytes, and a liver function test. All within normal limits except a marked elevation in cardiac enzyme. She has with a peak level of high sensitive cardiac troponin T and CKMB mass within the first 24 hours after the onset of symptoms, which showed 1579. The reference range is greater than 14. And a CKMB mass of 3588. Reference range for females is 3.77. So definitely showing some abnormal lab values there. So an echo is ordered. The results reveal severe left ventricular systolic dysfunction with an ejection fraction of about 30%, with marked regional wall motion abnormalities in the mid-anterior, mid-septal, mid-inferior, and apical segments of the left ventricle. definitely showing some signs of heart failure there. So this is a picture of the echo that we took on this patient. So with all the information that we've gathered, we go ahead and transfer this patient into town to the cardiac cath lab. They do the cardiac cath, and there's no signs of blockage, thank God. The left ventricular injection showed severe systolic dysfunction. So this patient was treated with beta blockers and angiotensin-converting enzyme, or ACE inhibitor, aspirin, clopidogrel, and diuretics. She was discharged from the hospital after 5 days without any complications during the hospital course. So pretty standard course of medications to give her. She was recommended to be reevaluated 1 month afterwards. At the follow-up visit, all the symptoms had disappeared, and the echo showed significant improvement in the left ventricular systolic function. In a nutshell, this patient returned to her normal state. So what happened here? Was it an MI? What exactly happened to this patient? She had all these symptoms, but there was no blockage. And the only thing that was really going on with this problem with her left ventricle. Well, folks, this is called broken heart syndrome. So broken heart syndrome, also called stress-induced cardiomyopathy or Takotsubo cardiomyopathy, can strike even if you're healthy. Takotsubo, by the way, are octopus traps that resemble the pot-like shape of the stricken heart. It actually looks kind of like a little broken heart. They use these over in Asia to trap octopus and stuff. Really, we see it a lot in Japan. You can see these little traps. And so they call that the broken heart syndrome. There's actually some truth about it being a broken heart. So guys and gals, emotional pain can absolutely lead to a real emergency. So women are more likely than men to experience a sudden intense chest pain, the reaction to a surge of stress hormones that can cause by an emotionally stressful event. We have to remember that hormones in our body control the functions of our body. For example, insulin is a hormone, and it helps to control the glucose going into the cell. So hormones are very important in our body. And so because of a stress, these hormones, it can be caused by an emotionally stressful event. It could be the death of a loved one, or even a divorce, a breakup, or a physical separation, betrayal, or romantic rejection. It can even happen after a good shock, like winning the lottery. That would be my luck, is that I would win the lottery and have a heart attack about 5 minutes later. But anyway, so emotional stress can actually lead to a real emergency. So is it a heart attack? Well, it's not a AMI. It's not an acute myocardial infarction. There was nothing blocked there. So broken heart syndrome may be misdiagnosed as a heart attack because the symptoms and test results are very similar. In fact, tests show dramatic changes in rhythm and blood substances that are typical of a heart attack. So we notice the troponin was up. But unlike a heart attack, there's no evidence of blocked heart arteries in a broken heart syndrome. However, so it's not a heart attack, so what is it? It is a form of cardiogenic shock. As we saw with this patient, she had the chest pain, and we noticed that she had EKG changes, and especially we saw that lowering blood pressure. In broken heart syndrome, a part of your heart temporarily enlarges and doesn't pump very well. While the rest of your heart functions normally or with even more forceful contractions, researchers are just now starting to learn the causes and how to diagnose and treat it. But basically, it causes a swelling of that ventricle, and the heart actually gets bigger from that, and we can see some serious issues with these patients. Is it serious? Broken heart syndrome can lead to severe short-term heart muscle failure. Yes, very serious. The most common signs and symptoms of broken heart syndrome are angina, which is chest pain, and shortness of breath. You can experience these things even if you have no history of heart disease, just like the lady in our presentation today. Arrhythmias, irregular heartbeats, or cardiogenic shock also may occur with broken heart syndrome. Cardiogenic shock is a condition in which a suddenly weakened heart can't pump enough blood to meet the body's needs, and it can be fatal if it isn't treated right away. So we started treating it as soon as we started seeing signs of that. When people die from heart attacks, cardiogenic shock, believe it or not, is the most common cause of death. So it's important for us to recognize cardiogenic shock and begin to treat it immediately. So what should we do in this situation? Any complaint of chest pain should receive a full cardiac workup to rule out infarction or other serious cardiac issues. On the EMS side, any complaint of chest pain should be thought of as cardiac until ruled otherwise. Because it's, there are times when people are having chest pain when it's pleuritic or they're having difficulty breathing that's causing chest pain. But a sudden onset of chest pain like that, where she's clutching her chest and stuff, definitely should receive all of the cardiac stuff, which she did receive on the way to the hospital in this scenario. In this case, there was evidence of pump failure and the need for further investigation and treatment. So the staff did a really, really good job. The good news is that most patients will recover when we provide good cardiovascular care. So if we would have just left this patient alone and just go, well, it's just maybe psycho and in nature and it's related to the stress and maybe there's a panic attack or whatever, this patient could have deteriorated from the real and very, very serious nature of the cardiogenic shock that she was in. So heart attack versus broken heart. So signs and symptoms of broken heart syndrome different from those of heart attack. In broken heart syndrome, symptoms occur suddenly after extreme emotional or physical stress, and here are some other differences. But real AMIs can also happen due to extreme or physical stress, so be careful. EKG. We need to do an EKG. The results don't typically look the same as EKG results for a person having an heart attack, but we can see either ST elevation or ST depression. Blood tests show no signs of heart damage. The tests show no signs of blockages in the coronary arteries. We did have some abnormal lab values, but we sent the lady off to the cath lab. They went in and did a cath and noticed that there was no blockage. Typically, tests will show ballooning and an unusual movement of the lower left chamber in the left ventricle and show that there are changes. Very, very common with broken heart syndrome. Recovery time is quick, usually within days or weeks compared to the recovery time of a month or more for a heart attack. So this patient, once treatment was given, the patient's symptoms resolved and she was back to her normal state prior to the event. So guys and gals, what I want you guys to understand, especially this time of year, there's going to be, especially Valentine's coming up, there's a lot of broken hearts that are out there. So remember, an emotional broken heart can often lead to a real life broken heart. So guys and gals, what I want you to understand is that anytime that a patient is presenting with anything that could appear as cardiac in nature, we need to always we need to investigate the cause of that chest pain, be thorough in our assessment, EKG, labs, and everything. And if we see anything that's abnormal, we need to do our very due diligence to make sure that we're treating it appropriately. So this lady had a great outcome. So remember, that chest pain patient comes in with it's emotional and crying over a very stressful event, could have a emotional broken heart and a real life broken heart as well. So thanks for listening, guys. I hope you enjoyed our little Valentine's presentation on a broken heart. Hope you have a great day and hope that your heart isn't broken on Valentine's Day.